Good afternoon, everyone. My name is Lorne Terrell, and I have the honor of serving as the chair of the board of the Institute of Health Economics. On behalf of the members of the IHE board, our CEO, Egan Johnson, and the whole IHE team, it gives me great pleasure to welcome you here to the 16th IHE Innovation Forum. These regular forums are held in conjunction with our semi-annual board meetings, and this tradition started in December of 2008. I'm very pleased that they are so successful, and I think we've become an important fixture in the healthcare landscape. They provide an opportunity for Alberta health system leaders to gather and learn from international and national thought leaders. They also provide a chance for all of us involved in healthcare system to discuss informally how these lessons might be applied to our province. As I've often said, these forums, good things happen when good people get together. The IHE is very pleased to be the catalyst in supporting these regular opportunities for good things to happen. Before introducing our first speaker, I would like to take a moment to thank a few people. I'd first like to thank the board of directors. I'd also like to, it's a unique organization that brings academia, healthcare system, public service, and the private sector together. The problems we face in healthcare system are challenging and complex. They will only be solved through important partnerships. I'm pleased to lead an organization that embodies embodiment of this sentiment. I would also like to take this opportunity to provide a special thanks to Egan Johnson, the CEO of the Institute of Economics. Under his leadership and with the support of the team, he's built at the Institute into a thriving organization recognized nationally and internationally. Thank you, Egan, and thank you, everybody at the Institute. Today's topic is a very timely one, given the current circumstances we face in the province. There is a program in the province called Choosing Wisely, which everyone, I think, is familiar with. It encourages physicians to speak to their patients about low-value tests and procedures and consider alternatives. We have taken that phrase and applied it to the title of this forum, Managing Healthcare Costs Wisely. There has not been a culture in Alberta of controlling costs. In many cases, when faced with pressure, we have papered over the problems by spending more. This has resulted in per capita spending in Alberta higher than any other province in Canada and higher than most healthcare jurisdictions. At the same time, we have not had significantly better performance in those key indicators and the use of these increased resources. The key is not simply slowing growth, but also ensuring as much value as we can for Albertans from the spending that we're using. I'm pleased today to welcome the Senior Assistant Deputy Minister of Health for Alberta Health, Martin Chamberlain. Martin has the responsibility of preparing and managing the budget for Alberta Health, not an enviable task. Alberta Health budget accounts for about 40% of all the provincial spending, and I suspect it supports the salaries of most people in this room. Managing healthcare costs wisely is essential for healthcare sector, but also for other parts of government. Education, human services, economic development, all contribute to improving healthcare outcomes in the province. Our ability to invest in those areas depends on healthcare spending growth to be controlled. I would like to now call on Martin to provide some greetings from the province of Alberta.
Thank you, Dr. Terrell. Firstly, I would like to express greetings on behalf of the Honourable Sarah Hoffman, who's Deputy Premier and Minister of Health, as well as our Deputy Minister, Carl Ammerheim, who had wanted to be here today, but he got sucked up to Fort McMurray. They've had a few problems, and he's trying to solve them all today. He had wanted to participate in the discussions today, so I'm expected to report back to him, and he's asked me to sit on the panel later this afternoon. I did want to express a few things on his behalf. He wanted to thank the Institute of Health Economics. They've been a good partner for us working on independent economic analysis, organizing forums like this. They help us a lot with our health technology assessment piece. So he definitely wanted to thank IHE for organizing today and inviting us to the controlling healthcare costs wisely. I notice there's a XVI 16 up there. I assume that's a Super Bowl type football reference. That seems appropriate since we should shortly have an Edmonton-Calgary Grey Cup in Toronto. So I'm looking forward to some of that. The topics today, though, are very apt to where we're at. Clearly, we have issues across the country, but certainly in Alberta with respect to controlling healthcare costs. We need to be able to do that in a wise fashion. It's become a real priority for us in Alberta because of the current economic situation. With dropping provincial revenues, we have to be able to find ways to manage our healthcare budget, that 40% of the provincial budget that Dr. Terrell was speaking of. And yes, that is fun managing that. And if anybody's looking for money, the correct answer is no. Because it is very difficult to manage a very expensive budget that's been growing at almost 6% per year for years in a time when provincial revenues are dropping. And any advice that you can give us today would be very helpful, and I'm hoping to listen and learn and get some wonderful ideas that I can put into action. And I will sit in the panel later, hopefully not to ask or answer too many hard questions, because I haven't figured out the answers yet. If I did, I wouldn't be here. I'd be out implementing. Anyway, I'm hoping we have a very good and productive afternoon. So thank you again.